Welcoming you again in this class of General Management in Toxicology. This is the last class or the part 4 of the entire class of General Management of Poisoning. In earlier 3 classes, we have already discussed about the different type of poisons, the method of treating the patient at the emergency level, the analytical toxicology part, and in the class that was just previous to this one, we had started discussing about the specific treatment. We had stabilized the patient in the earlier class. How these were done, we have already discussed, and the rest of the part we'll be discussing in this presentation. Now that the patient has been stabilized, we start the second phase of treatment, which is known as decontamination. Decontamination has again another name. We also called it the elimination of unabsorbed poison. That means the poison that has not been absorbed into the body, that is still lying in the gastrointestinal tract or over the skin or over the eyes, in which way the person has taken, we will have to decontaminate it at that site or from that site. Decontamination depends upon the type of poison or the type of route of administration. If the person has taken it over the skin, or there is a spillage over the poison over the skin, and the skin has to be decontaminated. But if the person has taken it by oral means, that is, it is an ingestible poison, orally the person has taken, then we'll have to decontaminate the gut. Similarly, if the poison has come in contact with the eyes, we'll have to decontaminate the eyes. Or the poison has got into the lungs, then we'll have to decontaminate the lung before the gas or anything else that has been entered into the lung is going into the systemic circulation. So here it is. We will discuss first the method of decontamination of the skin. It can happen so that the poison has directly come in contact with the skin, or the patient was trying to take the poison by oral means and there is a spillage over the skin. In both the cases, we'll have to decontaminate, and the method is very clean and clear, as you see in the picture, that you'll have to protect yourself. So now you can know what is a PPE. It has come up in the context of corona. So you people, it is better to work with these. The workers have to take a PPE and then make the person stand in a shower after removing his clothing and flush with the water or the normal saline. It is better to give a fresh pair of clothes. Please do not use any kind of oily or exorbitant soaps, etc. Soap is usually given when the substance is only oily. Otherwise, it is not needed at all. The chemical neutralization can cause potential injury. So this is the thing that has to be kept in mind. Corrosive agents injure skin and can have a systemic effect. So it is not necessarily that when the patient is come with a history of corrosive intake, you will not go for the decontamination of the skin. There are other substances like organophosphorus substance which is absorbed through the skin. In those cases also you will have to decontaminate the way it has been shown in the picture. Next is the decontamination of the eyes. Whenever there is a splash into the eyes, the best method of doing it is to give a huge amount of water or normal saline. Just wash it copiously after removing the contact lenses. This will be enough for decontamination of the eyes. You can use local antiseptic drops. And if the person is suffering from any kind of pain, you can give analgesics. Mostly the paracetamols are usually given. Continue irrigation until the pH is normal. This can be identified by a pH meter. We can use different type of strips to see until and unless the pH is normal, we will have to go for irrigation. Finally, we'll have to look for the slit lamp and fluorescence examination. This slit lamp examination will determine what is the depth of the injury. If it is over the cornea or any other part also, we'll have to take a consultation of the ophthalmologist. Decontamination of inhalation agents is another important thing. Here we don't have very much different agents in our hand. It is better to give some supplementary humidified oxygen. This will help in decontaminating the lungs. Please remember to look into the airway obstruction. This has been dealt in the ABC classification that we had seen, that is usually done at the emergency level, but after the patient has been transmitted to the ward, please do not forget to look into the airway obstruction before giving any kind of oxygen supplementation. You can intubate the patient as and when necessary. Now, this is the important aspects of gastrointestinal decontamination. Why I am telling this is important? Because in most of the cases the patient comes with a history of ingestion or ingested poison. In those cases it is always to look for the amount that has got or entered into the stomach and will have to decontaminate with it. Now, there are a long list by which in most of the books it is written that these are the methods by which we can go for decontamination. The long list is being given here. You can start with induced vomiting. The second one is the gastric lavage. The third one is the using of adsorbent. Please remember, this is not an absorbent, but it is an adsorbent. Catharsis, and finally we can go for a whole bowel irrigation. So these are the different steps or the 5 steps of gastrointestinal decontamination. Vomiting or induced vomiting had been a very important aspect of gastrointestinal decontamination for a long time, because especially in India, because India produces a drug which is known as the syrup of Ipecac. This is a herb that is grown in West Bengal only, and this can induce vomiting, and there is a lot of cases where the patients were being given this drug in order to induce vomiting. Induction of vomiting by Ipecac or the syrup of Ipecac has long been being accepted in the books of forensic medicine and toxicology. It is being written there that there is a risk of aspiration pneumonia or aspiration of the emesis during the process of emesis. If we give Ipecac, the dose is 15 ml for 1 to 12 year boys and 30 ml for the adults. You can repeat the dose. Most of the vomiting occurs within the first 20 minutes of the dose, but the rest may require a second dose, where almost 97% of the patient vomits. It is also written that usually 3 to 5 episodes of emesis occurs and it resolves within 2 hours. This is a age-old induced vomiting process, but please remember, this is a myth now. We do not use any kind of emetics, even if it is being available to us, because the reason is, whenever these kind of systems are in vogue, we have seen that the risk benefit ratio, the risk is much more. The risk of aspiration pneumonia is much more than the benefit that it does. Naturally, we have eliminated the induced vomiting and we do not use it nowadays. But in some of the books, as I have told from the first class, that in some of the books it is written, and sometimes people are being asked, so I have included it. You should not induce vomiting. The major advantage of treating the patient with poisoning is that most of the poison itself causes emesis. It is a protective mechanism of the body itself, that whenever something foreign material that is not being accepted by the body comes into it, it tries to eliminate it by the process of vomiting. So you yourself don't have to induce any kind of vomiting. The body by that time has already taken care of it. For all ingested poison, gastric lavage is an important aspect. But please remember that gastric lavage can only be done when the person has taken the poison within last 3 hours. There are some school of thought who tell that the gastric lavage can only be done for people who has taken the poison within last 2 hours. But for our benefit, we have increased the time till 3 hours, because usually the patient take poison along with multiple food items which can delay the gastric emptying time. A patient coming beyond 3 hours, you need not have to go for doing this gastric lavage. The method of giving gastric lavage is with water. Usually it is done with normal saline. We can also use plain tap water if we don't have the normal saline. In some of the situations, we can use normal saline with a mixture of 1:5000 potassium permanganate or 4% tannic acid in saturated lime water or starch solution. This is a method that we usually administer for those poisons which need to be oxidized. Say for example, the vegetable poisons. If we give potassium permanganate at a rate of 1:5000, that means 5000 ml, we give 1 ml potassium permanganate. In 5000 ml of normal saline or water, whatever you have in your hand, give only 1 ml of potassium permanganate. And when you mix it with it and then we give the gastric lavage, the chances of oxidizing the vegetable poison is more, and when this thing happens, the possibility of absorption reduces. Administration of water, that or the normal saline, is given at a context of 5 ml per kilogram dose. It is given 40 French orogastric tube, or the Ewald's tube. In case of children, it is 28 French. These are the numbers of the stomach tube that is being administered through the oral cavity, and through this stomach tube we give the gastric lavage. You people will be demonstrated the method of giving gastric lavage in your practical class. Till now you must remember that a tube is being inserted and we give water at a dose of 5 ml per kilogram of the body weight, and we take out the content from the stomach using the same water, and the water comes out through the same pathway through which we have inserted it. The position is very important. It will be in the Trendelenburg position or the left lateral position, in the same position that the patient had been carried from the emergency to the ward. This position usually reduces the chances of going into the lungs or aspiration. How long it has to be performed? It is usually performed until clear fluid comes out, or a maximum of near about 3 liters. Mostly when we give 2 liters of gastric lavage, the clear fluid comes out and we stop there. But before stopping, it is better to administer another thing through the gastric lavage. This is we called the activated charcoal. Activated charcoal, in Bengali we called it kat koila, is something that looks like this. It is a dark color substance. It can be obtained by burning the breads. In our poison information center, we get a lot of phone calls where the person says that the person has ingested this and that poison, and this activated charcoal is ubiquitous. We can use in any of the poisons without any kind of contraindication. This activated charcoal can be prepared in home by burning a bread, we call it a toast, and this burning has to be done until and unless the bread is dark in color. And when this thing happens, we take it out from the oven and we crush it, and it will look like this, as it is shown here, dark colored. and this amount of activated charcoal is taken. The amount is given in the picture, that is the dose is 1 to 2 gram per kilogram. Please remember, it is 1 to 2 gram per kilogram of the body weight. Mix it with some amount of water and pour it through the nasogastric tube. But if the patient is at home, we advise him or her to take it orally by using a glass of water and drink it in that way. It is better to use it within 1 to 4 hours. And what we have done is that when the people call us in our poison information center, we give this advice, and we have seen that since the patient has to be transferred from his or her home to the hospital and it takes time, giving this one at the initial part has saved a lot of life. Why this activated charcoal is very efficiently absorbs the poison. The word absorption, as you know, is defined as entering or entry of the poisonous substance or any other substances inside the body of the activated charcoal. This activated charcoal is now being utilized in different forms. It is given in face wash. You have seen, the ladies have already seen that activated charcoal mixed face wash are available. It cleans up the skin in this and that. Why this is so much beneficial? If we just look into the structure of this activated charcoal, we can jolly well understand. This is again a question that is you people are being asked to say that why activated charcoal is used as an absorbing agent. So if we look at the cross section of it, just look at this one. In the cross section, we will find that there are different pores over the activated charcoal. This is actually the pore that can be seen from above. But inside the pore, there are root-like branch and sub-branches. These poisons, when it comes in contact or comes in contact with this activated charcoal or near the activated charcoal, they are getting inside into these roots, and whenever they are getting here, they are being trapped inside, and when they are trapped inside, they cannot go out, and that is the mechanism how this activated charcoal acts. Welcoming you again in this class of general management in toxicology. This is the last class or the part 4 of the entire class of general management of poisoning. In earlier 3 classes, we have already discussed about the different type of poisons, the method of treating the patient at the emergency level, the analytical toxicology part, and in the class that was just previous to this one, we had started discussing about the specific treatment. We had stabilized the patient in the earlier class. How these were done, we have already discussed, and the rest of the part we'll be discussing in this presentation. Though there are a lot of contraindications as far as giving stomach was is concerned, but what about administration of activated charcoal? The answer is there is no such contraindication. So you can give this activated charcoal to any person with a dose that I have already mentioned, that is 1 to 2 gram per kilogram of the body weight, and it gives an excellent result as we have already discussed. Now, next method of decontaminating the gut is known as the catharsis. That means that whenever the poison has not been absorbed and is still remaining inside the gut, we can eliminate the poison through stool. In order to do so, we administer osmotic catharsis, which is along with the activated charcoal, just like that of a sorbitol citrate. 70% sorbitol, which is given 1 gram per kilogram of the body weight, or 10% magnesium citrate are the two most commonly used catharsis. That means by the use of these catharsis, we try to eliminate these poisons through stool. Remember that there are a lot of poisons which can stay inside the intestine a lot more time that we expect. These are said to be the controlled release preparations of pharmaceuticals agent. Whenever you come across any drug that is written SR or ER at the end, which means a sustained release or an extended release tablets, there is a possibility that they remain in the stomach for a long time, and for them, if the person has taken a huge amount, catharsis can be of excellent use. Shown to decrease the transit time of the activated charcoal is another important aspect of giving catharsis. If the activated charcoal remains more time in the stomach, the chances of absorption of different poison is again greater. The last one method is said to be the whole bowel irrigation. We use the commonly indicated in heavy metals like that of the iron, lithium, etc. And we use usually the polyethylene glycol. Please remember the name, it is not written here. Polyethylene glycol with electrolyte solution. There are some contraindications if the patient is having absent bowel sound or obstruction is there, or if there is any kind of complication like bloating, cramping, or rectal irritation. We do not give this whole bowel irrigation. Apart from that, we can try for in cases of heavy metal poisoning. Now we come to the other part of the second or the third set of treatment. Here the poison has got absorbed. Now we'll have to eliminate the absorbed poison. So earlier we were actually discussing about the elimination of unabsorbed poison, but here we will be discussing the elimination of absorbed poison. There are different methods of eliminating the absorbed poison. It includes the alkalization of the entire milieu of the blood. Acidification of the urine is another method. Forced diuresis is the another method. It can be dialysis or hemodialysis, or hemoperfusion can be the other methods. So there are different methods by which we can eliminate the absorbed poison. Forced diuresis, as the name suggests, it involves the administration of the diuretic agent as well as the isotonic saline to increase the urinary flow. So we administer normal saline and give a high saline diuretic in order to eliminate the poisons that has already been absorbed. But please remember that this forced diuresis is not effective in all kind of poisons. It is effective mostly in those cases or those poisons which are acidic or basic in nature. Especially acidic in nature, they work more in case of forced alkaline diuresis. If we can make the milieu of the blood or the urine alkaline, then these acidic components gets eliminated very quickly. Example includes the barbiturates, which is actually the barbituric acids, as well as the salicylates. We use sodium bicarbonate in order to alkalize the urine. The main objective is to increase the urinary flow to near about 3 to 5 ml per kilogram per hour. So this is all about forced diuresis. Again, please remember that this diuresis is not effective for all agents, because most of the agents, they have a volume distribution of higher capacity, as well as they might not be dissociated as an acidic or basic salts or components. Naturally, these are not effective. They are also not effective where the poisons are protein bound. Next important method by which we can eliminate the absorbed poison is known as the hemodialysis. If we just look at the picture, this is mostly the very simple method of depiction of this hemodialysis with the hemodialysis machine. It is a process of altering the subsolute component of the blood by removing it from an artery, and then it passes through a filter, and then it is again transferred into the body through the vein. If we just look at this picture, we'll see that the method of transmission is very clearly shown here. We use a cannula which is directly associated with an artery through which the blood flows, and this blood flow is next controlled by a blood pump. We give a blood thinner, which is mostly the heparin, because as we know that whenever blood comes out from the body, there is a possibility of getting clotted. Next, it is passed through this filter. Whenever this passing is occurring, there is a fluid which is known as a dialysis fluid. This fluid is infused, and when this infusion is occurring, it presses through this pathway of the blood through some capillary tube, and a method of osmotic transfer occurs. When this osmotic transfer occurs in this filter, all the toxin materials, including the urea, creatinine, it comes out from the blood, but the blood remains in the same form. And after that, the pure blood is now transferred into this channel, which is ultimately transferred into the blood vessel through the vein into the body of the patient. So this is how the hemodialysis works. Hemoperfusion is another method by which we can eliminate the absorbed poison. It removes the drug and the toxins from the patient's blood by pumping the blood through the cartridge of an adsorbent materials, just like that of an activated charcoal. So basically the hemoperfusion and the hemodialysis are more or less the same thing. The difference is that in hemodialysis we use an capillary tube which is having a selectively permeable membrane, where in case of hemoperfusion we use this activated charcoal to eliminate the poisons. Again, you should be remembering this important aspect that it is not necessary that all the toxins can be hemoperfused or hemodialyzed. In order to hemodialyze or hemoperfuse the toxin, there are some basic requirements. The toxin has to be highly volume distributed. That means the volume distribution of the toxin has to be high, which means that it has to be uniformly distributed throughout the blood or throughout the body of the blood. Then only we can dialyze this specific poison. Again, those poisons which are protein bound, it is not very easy to hemodialyze or hemoperfuse. Those poisons which are themselves protein in nature, again it is difficult to hemoperfuse, or it is not possible simply to hemoperfuse or hemodialyze. That is the reason that the snake venom, when it enters into the body, we cannot hemodialyze or hemoperfuse and eliminate it from the body by doing all these methods. Now this is more or less the penultimate method by which we can treat the patient, which is known as the antidote administration. Antidote is any substance, as it is written here, is an antagonist. It counteracts the action of another drug. In this is as stated in the pharmacology. Although the general public often believes that there is an antidote of each and every drug or toxin, but actually the opposite is closer to the truth. We have an array of poisons which is not having any kind of specific antidote. That is the reason that throughout the discussion of the treatment, we were considering mostly about how to make the patient stabilize, how to eliminate the unabsorbed and the absorbed poison, because we may not get the antidote in our hand. Even if it is available, it may not be readily available in order to save the patient's life. There, in fact, are very few antidotes. Here we classify these antidotes. The antidotes are usually classified into the following group. The first group is said to be the inert complex formation. This method of administering antidote is mostly by oral or IV mode, where the antidote that is absorbed, it catches hold of the toxins, and the complex that is formed is neither causing any kind of harm nor itself is any toxic in nature. That means the poison antidote complex that is formed is an inert material, just like that of the chelating agents. So all those chelating agents, like that of British antilucide or the calcium disodium EDTA, the T-penicillamine, all these chelating agents actually catch hold of the heavy metals and they form this inert complex. Next is the method or the type of antidote which acts by accelerated detoxification. The example is like that of the acetylcysteine in paracetamol poisoning. That means paracetamol, which is per se is highly toxic as far as the liver is concerned, when we administer this kind of antidote, they quickly detoxify the body by making a complex or eliminating the poison by detoxification method that is done very quickly. Next is another type of antidote which acts through the reduced toxic conversion. Under it is the example of ethanol in methanol poisoning. That means that methanol maybe per se is a toxin itself, but when we administer ethanol in methanol poisoning, though ethanol itself is again toxic, but in a dose that is very much therapeutic in nature, we'll see that the conversion of methanol into formaldehyde is reduced because of the administration of this ethanol. The enzyme that causes this conversion is now being converted or is now being interested in ethanol itself, and methanol, which is converted into formaldehyde, is much more toxic, and this component is not being formed. Next type includes the receptor site competition. The example is naloxone on opium. I think you people have gone through all these things in your pharmacological class, so I will not go into the detailed explanation. When we'll be reading this specific poison, we will discuss it there. Another one is known as the receptor site blockade. The simple method of blocking the receptor site where the toxin acts will eliminate its effect, just like that of atropine that is done in organophosphorus poisoning. The last but not the least is the type of antidote which acts by toxic effect bypass. This toxic effect bypass mechanism is nothing but the poison, if we can eliminate that poison by giving another component which is termed as an antidote, where the effect of this poison is reduced by bypassing the pathway in which this poison is causing this menace, can be useful. Just like that of 100% oxygen, we call it a hyperbaric oxygen in carbon monoxide poisoning. So these are the different type of antidote that we administer. You will get other classifications of antidote in your book, but this is an useful classification because you can know that what are the different methods by which these antidote acts. Please do not forget to say something about the psychiatric care, because most of the patients who take poison in order to end up their life, if it is not an accidental poison, they definitely require a psychiatric care. And please refer the patient for a counseling so that they do not suffer from these complications anymore. Or you have another option. You can just call up our number. We will guide you through the entire process of treating the patient. I am there to help you out. There are other doctors in our department, especially in the Poison Information Center. We will help you out if you give the call in this number. Again, thank you very much for patient hearing. Hopefully you enjoyed all three classes. It would have been better if I could have taken it in front of you people, but in this corona environment it became extremely difficult. Have a good day. Thank you again.